Stop putting that costly dark spot serum on your face every morning. I realize that may sound odd coming from a doctor. You may have spent years buying $60, $80, even $200 bottles that promise to lighten age spots in 4, 6, or 8 weeks. But if you looked honestly in the mirror today, those marks are probably still there. Maybe they look slightly lighter, maybe new ones have shown up on your cheeks, forehead, or the backs of your hands. And now you are wondering whether any of those products are truly doing what they claim. What I am going to share today is one simple kitchen ingredient that works on pigmentation from the root. It is not something most dermatologists talk about, not because it has no value, but because doctors are usually trained to prescribe products, not search your kitchen cabinet. Today, we will look at why dark patches become more common after 60, why many drugstore creams fail at the cellular level, and the 5 strongest natural compounds, ranked from number 5 to number 1, that may help your skin reduce discoloration and regain a more even tone. And the number 1 ingredient is probably already in your kitchen. It is so ordinary that you may have walked past it many times this week without ever thinking it could help your skin. But the science behind it is worth hearing, so stay until the end. Before we begin, leave a comment with your age and how long you have been dealing with dark spots or uneven skin tone. Has it been 6 months, 5 years, or 20 years? I read every comment on this channel, and I want you to remember that you are not alone. I still think about a patient I will call Margaret. She was 68, a retired school teacher from Portland, Oregon. 3 years ago, she told me something I will never forget. She said, "Dr. I have spent more money on dark spot creams than I spent on my daughter's wedding dress." I did not laugh, because I understood exactly what she meant. Margaret had spent decades trying one product after another. She was tired. She felt as if her skin was telling a story she did not want to tell, a story of aging that made her feel unseen. So let us break down what is really happening inside your skin. This is where real science separates itself from beauty myths. The explanation does not come from a random wellness blog. It comes from peer-reviewed studies published in respected medical journals. Your skin has special cells called melanocytes. These cells make melanin, the pigment that gives your skin its color. You can think of melanocytes as tiny paint factories. When you are younger, they usually spread pigment evenly across the skin, creating a smoother, more balanced tone. But after years of sun exposure, ultraviolet rays, both UVA and UVB, damage the DNA inside these melanocytes. Once that damage builds up, the cell's pigment control system begins to malfunction. One key enzyme involved is called tyrosinase. Tyrosinase controls how much melanin your skin produces. Imagine it as the manager of the pigment factory. In healthy younger skin, that manager tells the cells to make a little pigment and then stop. But after 40, 50, or 60 years of repeated sun damage, that manager can become overactive. Instead of slowing down, it keeps sending the same signal, make more pigment. The result is concentrated areas of excess melanin. Those brown patches on your cheeks, forehead, and hands are not just surface stains. They are overactive pigment factories that have switched on and do not know how to shut off. This is why many expensive creams disappoint people. Even if exfoliants, peels, or bleaching agents fade some pigment on the surface, the spot can return if the overactive tyrosinase inside the cell is still running. You may lighten what you see, but the source underneath is still active. It is like covering rust with fresh paint without treating the metal beneath it. The rust returns because the deeper problem was never fixed. That is why these 5 natural compounds matter. They do not simply bleach the surface of the skin. They help influence the melanocytes themselves, calming the overproduction process at the cellular level. This is not just beauty folklore. These compounds have been studied in clinical research, and they target the deeper mechanisms behind pigmentation. Now let us begin the countdown, starting with number 5 and working our way to number 1. Compound number 5, niacinamide. This is a water-soluble form of vitamin B3, and it is one of the gentlest yet most clinically supported ingredients for improving hyperpigmentation and aging skin. One important study published in the British Journal of Dermatology examined its effects in a double-blind, randomized, placebo-controlled clinical trial. That is considered one of the strongest forms of medical research. In this study, patients with melasma and uneven pigmentation were divided into two groups. One group applied a 4% niacinamide cream twice a day, while the other group used an inactive placebo cream. After 8 weeks, the difference was clear. The group using niacinamide showed a noticeable reduction in hyperpigmentation, less facial redness, and a more even overall skin tone. But to understand why niacinamide is so useful, you need to know how it works. Unlike some of the other compounds we will discuss, niacinamide does not mainly shut down tyrosinase directly. Instead, it interrupts the movement of melanin from the melanocytes, where pigment is made, into nearby skin cells called keratinocytes. Here is a simple way to picture it. Imagine the pigment factory is still producing melanin, but the delivery trucks are blocked before they can leave the loading area. If the pigment cannot reach the upper layers of the skin, it becomes much less visible on the surface. That is what niacinamide helps do. It slows the transfer process, making it an excellent foundation for any dark spot routine. This matters because it prevents new pigment from becoming more noticeable while other ingredients work deeper inside the cell to calm pigment production itself. Niacinamide also has another major advantage, especially for skin over 60. As we age, the skin barrier, the outer protective layer, becomes weaker. That means the skin loses moisture more easily, becomes irritated faster, and looks duller or more fragile. Niacinamide has been shown to support the skin barrier by increasing ceramide production. Ceramides are natural lipids that help hold skin cells together and keep the barrier strong. A stronger barrier means better hydration, less sensitivity, reduced irritation, and healthier-looking skin overall. A review published in Cosmoderma in early 2026 looked at several clinical studies, and concluded that niacinamide is especially helpful for elderly skin, not only for pigmentation but also for broader skin health and resilience. Now let us return to Margaret. When she began her routine, I recommended a 4 to 5% niacinamide serum every morning. She applied it to clean skin before moisturizer and sunscreen. One reason I like niacinamide so much is that it works well with other ingredients. It is not harsh, it rarely causes irritation, it does not clash with vitamin C or retinoids. I often call it the friendly ingredient because it fits easily into almost any skincare routine. After about 4 weeks, Margaret began noticing changes. Her skin looked brighter, smoother, and less blotchy. The redness around her dark spots started to settle first. That inflamed ring that often appears around age spots became calmer. Then, little by little, the spots themselves began to fade. Compound number 4, kojic acid. Compound number 4 is kojic acid, and this one may surprise you. Kojic acid is a natural compound made by certain fungi, especially Aspergillus oryzae, the same fungus used in Japan to ferment sake, soy sauce, and miso. So yes, one of the most powerful natural ingredients for fading dark spots comes from the same fermentation process behind a bowl of miso soup. Kojic acid works very differently from niacinamide. While niacinamide blocks pigment from moving to the surface, kojic acid goes straight after tyrosinase. Remember that overactive manager inside the melanin factory, the one constantly ordering more pigment to be made? Kojic acid steps in and helps quiet that signal. It attaches to the tyrosinase enzyme and stops it from driving the chemical reaction that creates melanin. More specifically, kojic acid binds to the copper ions that tyrosinase needs in order to work. Without copper, tyrosinase becomes like a car with no fuel. The engine is still there, the key may be in the ignition, but nothing can move forward. The research behind this is impressive. In one randomized split-face clinical trial, kojic acid was compared with hydroquinone, the prescription-strength bleaching agent dermatologists have used for many years. The results showed that kojic acid worked about as well as hydroquinone for melasma and hyperpigmentation, but there is one major difference. Hydroquinone, especially with long-term use, can sometimes cause a condition called achranosis, where the skin darkens in a stubborn and sometimes permanent way. Kojic acid does not carry that same risk. It is gentler, it is naturally derived, and clinical studies show that it can help. A detailed review published in the journal Cosmetics in 2022 looked at years of research on kojic acid and confirmed its value for freckles, age spots, post-inflammatory hyperpigmentation, and melasma. The review also found that kojic acid can work even better when paired with other brightening ingredients, especially glycolic acid or vitamin C. That is because you are no longer targeting pigmentation from just one direction. You are addressing it from several pathways at the same time. For Margaret, I suggested an evening product with 1 to 2% kojic acid. She used it on alternating nights with another ingredient I will share with you shortly. Kojic acid can be a little irritating for some people, so I always recommend starting low and slow. I also do not suggest using it on the same night as strong exfoliating acids or retinoids. Now let me pause for a moment, if this information is helping you. And if you appreciate content that explains the real mechanism instead of just giving you a quick headline, take 2 seconds to subscribe below and give this video a thumbs up. This channel was created for adults in their 60s, 70s, and 80s who deserve clear, respectful, evidence-based health information. Your support helps this message reach more people who need it. Compound number 3, tranexamic acid. Compound number 3 is tranexamic acid. This is where science becomes especially interesting. Tranexamic acid, often shortened to TXA, is a synthetic form of the amino acid lysine. For many years, doctors used it mainly to reduce bleeding during surgery or to help women with heavy menstrual bleeding. But in recent years, dermatology has uncovered another powerful use for it. When tranexamic acid is applied to the skin, it can become one of the most effective options for stubborn dark spots and uneven pigmentation. The reason it works is different from the ingredients we have already discussed. Your melanocytes do not act alone. These pigment-producing cells constantly receive messages from nearby skin cells. When the skin is damaged by sunlight or inflammation, those messages can tell melanocytes to make more melanin. One of the key messengers involved is an enzyme called plasmin. Plasmin can trigger signals that push pigment production higher. UV exposure and skin inflammation both increase plasmin activity. More plasmin means stronger pigment signals. Stronger pigment signals mean darker patches. Tranexamic acid helps block this process. It interferes with plasmin activity and cuts off part of the chemical communication between damaged skin cells and melanocytes. In simple terms, the message that says make more pigment does not get delivered as strongly. A major review published in Clinical, Cosmetic and Investigational Dermatology in September 2024 examine the mechanism, uses, and safety of tranexamic acid for treating hyperpigmentation. Several clinical trials have shown that topical TXA can visibly reduce melasma, dark spots, and post-inflammatory hyperpigmentation. Then, in January 2026, a study published in Nature Scientific Reports tested a newer formula combining tranexamic acid with niacinamide inside a biosomal delivery system. Neosomes are tiny carriers that help active ingredients move deeper into the skin. The study found that this combination performed better than more traditional formulas for improving hyperpigmentation, and here is the important point. Tranexamic acid is especially useful for pigmentation that refuses to fade. If you have tried vitamin C, kojic acid, or other brightening products for months and the spots are still there, TXA may be the ingredient your routine is missing. That is because it works through another pathway entirely. Instead of only blocking pigment production at the enzyme level, it targets the inflammatory signaling that tells melanocytes to overproduce pigment in the first place. This is why combining tranexamic acid with tyrosinase inhibitors can create a much stronger, multi-angle approach to dark spots. Compound number 2, vitamin C. Vitamin C is not new, everyone talks about it. I have heard about vitamin C for years, and you would be right. But here is the part most people never hear when it comes to vitamin C and dark spots. Many people are using it the wrong way. They buy a serum that has been sitting on a store shelf for months, exposed to air and light. By the time they finally apply it to their face, the vitamin C has already oxidized and broken down. At that point, it may no longer help the skin, and in some cases, it can even add to the oxidative stress you are trying to reduce. But when vitamin C is made correctly, it can be incredibly powerful. The form I am talking about is L-ascorbic acid, usually in a 10 to 20% concentration, with a pH below 3.5, stored in an airtight, opaque bottle. When those details are right, vitamin C becomes a double-action ingredient for fading dark spots. The first mechanism is antioxidant protection. Vitamin C helps neutralize free radicals created by UV exposure. Those free radicals are one of the signals that tell melanocytes to produce more melanin. So vitamin C works like an extra layer of defense between your skin cells and sunlight damage. It does not replace sunscreen, but it gives your skin additional protection at the cellular level. The second mechanism is pigment control. Vitamin C can directly reduce tyrosinase activity, which helps slow melanin production at the source, but there is a third benefit that many people overlook. Vitamin C is essential for collagen production. It helps the enzymes that build and strengthen collagen fibers in your skin. And that matters because when a dark spot begins to fade, the skin underneath still needs to repair itself. It needs to create healthier, newer tissue. Vitamin C supports that rebuilding process. It does not just help lighten the discoloration, it also helps the skin renew itself more effectively. A 12-week clinical study published in 2023 tested a pigment-correcting serum that included a stable vitamin C form called tetrahexyldicyl-ascorbate, along with tranexamic acid, niacinamide, and other active ingredients. The participants showed clear improvement in dark spots and overall skin brightness. But the most important finding was that the improvement kept building throughout the full 12 weeks. This was not a quick surface change. It was steady, lasting progress happening deeper in the skin. For Margaret, I recommended a 15% vitamin C serum every morning after cleansing. She applied it 5 to 10 minutes before using moisturizer and sunscreen. That short waiting time matters because vitamin C needs a chance to absorb before other products are layered on top. And what I told Margaret is what I want to tell you now. Do not treat vitamin C as something you can apply randomly whenever you remember. Morning use is important because that is when daily UV exposure begins. Vitamin C gradually builds up in the skin over days and weeks, creating a reserve of antioxidant protection. But it needs to already be in place when sunlight reaches your skin. Compound number 1, turmeric. Compound number 1 is turmeric, the bright yellow-orange spice already sitting in many kitchens. It is used in curry, rice, and golden milk, but it may also be one of the most underestimated natural ingredients for uneven skin tone. Turmeric contains curcumin, a compound that research suggests can help slow melanin production. Studies show that curcumin may suppress melanogenesis by lowering MITF, a master protein that controls pigment production. If tyrosinase is the manager of the pigment factory, MITF is the executive giving the order. When MITF drops, tyrosinase activity decreases, melanin production slows, and overactive pigment cells begin to calm down. Curcumin also works through antioxidant and anti-inflammatory pathways. This matters because inflammation and UV damage are major triggers for stubborn dark spots. By helping reduce inflammatory signals such as NF-kappa B, curcumin may remove one of the key messages that keeps melanocytes producing too much pigment. Research has also found that curcumin may help protect melanocytes from UV-related damage, meaning it may support both fading existing spots and preventing new ones from forming. But this does not mean rubbing dry turmeric powder directly on your face. Raw turmeric can stain the skin and does not absorb well on its own. For Margaret, I recommended 2 steps: a properly formulated curcumin serum or cream, ideally with an absorption enhancer like piperine from black pepper, and a simple weekly turmeric mask. The mask is easy: mix 1 teaspoon of organic turmeric powder, 1 tablespoon of plain full-fat yogurt, half a teaspoon of raw honey, and a tiny pinch of freshly ground black pepper. Yogurt gently exfoliates with lactic acid, honey hydrates and lightly brightens, and black pepper helps improve curcumin absorption. Apply the paste to clean skin for 15 to 20 minutes, rinse gently with lukewarm water, pat dry, and moisturize. Do this once a week for 8 to 12 weeks. Margaret used this mask weekly for 3 months, along with daily niacinamide and vitamin C, plus kojic acid and tranexamic acid on alternating nights. At her follow-up, she told me someone had asked what foundation she was wearing. She was not wearing any makeup. Now, no ingredient will erase decades of age spots in 7 days. Dark spots form over many years, so they require consistent care. But the right combination of turmeric, vitamin C, tranexamic acid, kojic acid, and niacinamide can create visible improvement in hyperpigmentation, even after 60, 70, and beyond. Your melanocytes are not permanently broken. They have simply been overstimulated by years of sun exposure, inflammation, and aging. These compounds help send the right signals so pigment production can return closer to balance. In the morning, use a gentle cleanser, then a 15% vitamin C serum. Wait 5 minutes, apply 4 to 5% niacinamide, then moisturizer, then broad-spectrum SPF 30 or higher every day, even indoors. Sunscreen is essential because UV exposure can undo your progress. At night, cleanse gently, use kojic acid 1 to 2% or tranexamic acid 3 to 5% on Monday, Wednesday, and Friday. Use a curcumin or turmeric-based serum on Tuesday, Thursday, and Saturday. Let Sunday be a recovery night with moisturizer only. Once a week, use the turmeric, yogurt, honey, and black pepper mask. It combines gentle exfoliation, pigment calming support, and improved curcumin absorption in a simple home treatment that costs less than $1. Dark spots do not appear overnight, and they will not disappear overnight either. They are the result of years of sun exposure, inflammation, weakened skin repair, and overstimulated melanocytes producing too much pigment for too long. But the good news is this: your skin can still respond. Even after 60, 70, or beyond, your cells are still listening. They simply need the right signals. Niacinamide helps stop pigment from reaching the surface. Kojic acid helps slow the enzyme that produces melanin. Tranexamic acid helps block the inflammatory signals that keep dark spots active. Vitamin C protects, brightens, and supports collagen repair. And turmeric, through curcumin, works deeper by calming the master switches behind excess pigmentation. Together, these ingredients do not just cover dark spots. They help address the reason those spots keep coming back, so be patient, be consistent. Protect your skin every morning with sunscreen, nourish it with the right ingredients, and give your routine enough time to work. Real skin repair is not about harsh bleaching or quick promises. It is about helping your skin return to balance, one day at a time. If you found this video helpful, please subscribe to the channel and turn on the notification bell so you do not miss the next evidence-based health and skincare guide. And if you know someone struggling with stubborn dark spots, uneven skin tone, or aging skin, share this video with them. It may be exactly what they need to finally understand what their skin has been trying to tell them.